therapist will lay out what's expected of them. That, you know, you're going to be coming here for 20 to 24 visits, that we're going to do regular progress evaluations every 10 to 12, and that you need to do your homework. And every week, you've probably seen them, they actually get homework sheets, and they have to write, you know, the therapist writes down what the activity is, but they have to check off that they've done those activities. And at that first session, they will give them a packet that has information about how important it is to do your homework. It includes some success stories, so they hear about other cases, people that did vision therapy, and, you know, how it worked positively. And it'll go over the financial information too. So, you know, they say most people, it takes at least 3 or 4 times for something to sink in. You have to hear it that many times. So they're hearing it a little bit on the phone, that we're, you know, interested in more functional vision. That's not just about eyesight. They hear about it in the pre-testing often, then with the exam. Then, you know, Deb will call them. Then we have these workshops, and then they're hearing it in the first session. And you still have patients that ask questions and get confused and aren't sure why they're there. And in the progress eval, I have to review that, no, this is just the progress eval. We're going to continue vision therapy. This is just identifying where we need to go. And, you know, again, it's just human nature. These are new terms. Nobody ever thinks about vision. We all take it for granted. We don't recognize that there are things that go into vision. Getting things clear, keeping them clear, being able to shift your focus quickly, near and far, being able to track quickly and smoothly and remember what you're reading, to be able to keep those eyes pointed here without them starting to drift off. So those are all skills that are learned, that are treatable, that are enhanceable, and that's what we're doing in vision therapy. But again, that's something that's really important to educate people about, because they don't necessarily understand that concept, and that's really, you know, what we continually do in therapy and in the progress evals. But I thought it was important for you guys to understand that, so this way, you know, if people ask, you can say, no, this really works, you know, take a look at the success stories on the website, or, you know, make sure you're doing the homework, because the more you do the homework, the better you'll get, and the faster the therapy will work. You know, we have the progress evaluation scheduled. That's really important for you to keep that appointment, because we need to make sure that we're giving you the best treatment possible. So these are all steps and parts of vision therapy that you guys can contribute to by, you know, supporting them and encouraging them to continue coming. When they forget their homework, you know, call them up, or, you know, ask them, can I read it to you? Because sometimes they leave their papers up here, you know, make sure they get them. A flipper, those are the funny glasses where they actually literally flip. One side has a plus lens, the other side has a minus lens, and that's actually creating a shift in that focusing system, so they get it clear on one side, get it clear on the other, and that's developing flexibility in their accommodative or focusing system. We give out the binocular packets. Those are red-green glasses, and they have all sorts of red-green activities. Those are all really important for following through on what they learn here. So they learn how to be binocular, they learn how to see 3D here, but, you know, that's only half an hour in a week. They need to really practice these things. A lot of research that shows that if you want to get good at anything, you have to practice it. So they have to practice, and you don't have to do a lot. 10-15 minutes 4 or 5 times a week can make you better at anything. So, you know, getting them to practice and encouraging them to make sure that they're doing their home therapy when you're checking them in or checking them out, you know, is helpful. Some of the other things that we give out are computer programs. So the computer programs are for different things. We have some that work on tracking, some that work on lazy eyes, some that work on eye teaming problems. So those computer programs are perceptual processing problems. They work on visual memory and all sorts of things. Those things are all helpful. They usually take 3 or 4 months to actually get through an entire program, but they might call and say, I'm having trouble with the program, refer them to Susan. Susan handles it, or you can refer them to the company that makes it. There's usually 2 or 3 companies that we use, but you can look in the chart to see what we gave, or that should be, we should be entering that into the notes in the chart, so we know what the computer program is and what the user ID and the password is, because most of them are internet-based. So they just log in and it shows up on their screen. The last thing that I'll talk about is the Syntonix glasses. That's the colored light therapy. That's something that's really, really powerful, and that's the course that I just went to in Santa Fe. It was unbelievable, the research that they're doing, and Europe's using it. I mean, they're way ahead of us in terms of colored light therapy, but the colored lights really can make very quick changes in the whole visual system and the whole nervous system. So it actually helps to balance out that nervous system very, very simply. You've got people that are on the sympathetic side, they're sort of anxious and they're nervous. Their eyes tend to diverge. They have trouble focusing. They're sympathetically overloaded. Then there's the other side, which is parasympathetically stressed, and those are the ones that are kind of closed down. They're like more calm. Those two systems, it's the fight or flight system and the rest and digest system. And that's where they tend to, the parasympathetics, they might be over converging, they might have an eye turn in or over focusing, becoming nearsighted. So those two systems are out of balance, and you give colors that will bring them to balance. Syntony means harmony or balance. So that's what we're doing with those glasses, and they're very effective. So we give them the glasses to use at home. They put on these funny sunglasses, look at a light. It should be an exposed bulb, a 50-watt bulb, about 2 feet away in a dark room. And they look at it for about 20 minutes a day, and it might be for 2 weeks, 3 weeks, months, depending on if they're a TBI patient, traumatic brain injury patient, stroke patients. There's certain colors that work really well, and then there's combinations of colors. So a lot of times we might have them do 10 minutes of one color, 10 minutes of another. They'll do it here with our instrument in the back, or we'll send them home with it. But again, that's something that's really powerful, and again, they might ask questions like, does this work, or what am I supposed to be doing? And it'll be important for you to understand that. We're trying to get it a little bit more streamlined. We actually bought little holders to put the colored glasses in, and then we'll have like a sticker that has the instructions on it. We have to order that. But that's the other piece to the vision therapy, and what we're going to be adding with that piece is we have to do the color field, those visual fields that are done in different colors. You might have seen them on the black paper. So those color fields actually have to be repeated fairly regularly as you're doing the colors, because you might change the colors or adapt the colors based on the color field chart. So we're trying to set it up where those are done every 2 or 3 week mark, and then at a 4 weeks after that. So we'll try to schedule a few more PEs, progressive evals, for those patients that we're doing more of the color field. So I'm telling you about it because we'll be starting to do more color and syntonic vision therapy patients over the next few months. So I just talked a lot. Does anybody have any questions? Does that give you a little better understanding of what we're doing?
Now, especially what you do now, it's like you just don't do the regular test.
Yes.
Now we understand what you do, what 3 things you do when you take them into the room.
Exactly.
Which
so
I can't understand the name, but now I know there's just a lot
yeah,
more.
there's the basic exam where you're looking at eye health and disease, and if they're nearsighted or farsighted. But then there's this whole other piece where we're looking at, all the functional vision is what I call it.
Okay.
So any primary hearing exam, you should have an idea of whether or not you need to do additional testing, but most of the time you can tell by the history. I mean, if you guys get good at this, you'll be diagnosing the patient before I even start with them, because you'll hear that they have a tracking problem, or they have trouble with reading or focusing, or things go blurry. If things are blurry, then it's an accommodative insufficiency. If they have trouble tracking, then it's a saccadic dysfunction. So, there's a lot that you can get in vision out of an exam, and then a lot that we can treat in vision therapy. And you see the kids. I mean, if you've been here enough, you see some of these kids that were bouncing off the walls. They're calmer. They're better behaved. And then you'll see the parents are happier. If you listen or you ask for the success stories, if I forget, make sure you ask too. If they are completing vision therapy, or if it's their last session, make sure they sign a success story. It's on Google Docs, and just say, this is your last session. So what's changed, or what's the best thing that happened to you from doing vision therapy? And they'll tell you, and it's actually exciting because the more they get how much the vision therapy did, the more they're going to share that with other people. And we want as many people that can benefit from vision therapy, knowing about it. It used to be like the best kept secret, but now people are really looking. You got the internet, and people are really searching out. I mean, it used to be that every patient was a referral. Now probably half of them come from the internet. They just looked up, vision and learning problems, or reading difficulties, and they're finding this information. So, we want to just share that success, and invite them to think of other people that could benefit from it. Anyway, any other questions? Thoughts? Haley, you can watch the video.